Hello, my name is Dominica Lema, and today I will to talk about congenital syphilis. Definition: Congenital syphilis is a multi-site system infection caused by Treponema pallidum and transmitted to a fetus through the placenta. It is an easy social medical problem to treat if diagnostic and treat promptly.
Or syphilis that a newborn will contract while still in their mother's uterus. So we'll write contract in utero or contract in uterus. So congenital syphilis is an important disease to screen for in pregnant women because 2/3 of infected neonates or newborns have no symptoms. So they're without symptoms. So many of these babies will start to get features of syphilis later on. And we can split the types of symptoms a baby will have based on time. So there are early symptoms, which occur from birth, so they can be present right away in that 1/3 that do have symptoms at birth, to the first few years of life. This is in contrast to late syphilis, or late congenital syphilis, where you won't see any of the symptoms I'll list here from birth, but they happen after the first few years. Now, one of the first things you might see in a newborn that's infected with syphilis is a really big liver. So let me draw a giant liver here. So this is a really big liver. And then on top of that, they could also have a giant spleen. So I'll draw the spleen really big here as well. And we refer to this when they happen together as hepato, so hepato referring to the liver, spleno, so the spleno referring of course to the spleen, so hepatosplenomegaly.
Applications in medicine. Congenital syphilis is an easy social medical problem to treat if diagnostic and treat promptly.
البكتيريا بتعملها اسمها ايه؟ تريبونيما باليدم، اسمها سبايروكيت. ماشي؟ ماشي؟ طب هل التريبونيما دي الاستيننج بتاعها يوجوال بكتيريال ستين؟ ما بتعمل حاجه اسمها ايه؟ بنشوفها بحاجه اسمها دارك جراوند illumination. ماشي. طيب المود اوف انفكشن كانت بتيجي ازاي؟ ايه المود اوف انفكشن للتروينيما؟ ها مين فاكر؟ يا اما سيكشوال انتركورس او كونتاكت مع سكين ليجن، صح كده؟ تمام كده؟ وممكن عن طريق الدم، صح؟ بلاد ايه؟ ترانسفيوجن، وممكن الام تنقله للايه؟ لطفلها عن طريق الايه؟ الماشين. يعني ممكن ده يعدي من خلال الايه؟ الماشين. في مشكله؟ فايا بلاسنتا. طيب وقلنا ان الانواع بتاعته تايبس اوف سيفيلس. ماشي؟ على حسب لو جه عن طريق سيكشوال انتركورس ولا عن طريق المشيمه. ماشي. سيكشوال انتركورس بنسميناه ايه ده؟ اكوايرد سيفيلس. فايا بلاسنتا اسمه كونجينيتال سيفيلس. ماشي. طيب
Pros and cons. Ray a Wessner in pregnancy women about syphilis screen routinely in the first trimester and during pregnancy. Cons. The overall risk of transplacental infection of the fetus is approximately to 60 to early percent and they probably increase during the second half of pregnancy.
Age-old killer, syphilis. The deadly infection is transmitted sexually and then passed unknowingly from a mother to her unborn child. Half of the infected babies die, and those that survive can go on to become blind, deaf, and suffer brain damage. Baby Philip is being tested for the disease. He was brought to the hospital a year ago, his body covered with blisters.
He got all the symptoms. The spleen was enlarged, and also the liver was enlarged.
His life-threatening illness was caught just in time. He was given penicillin to clear the infection which had been passed to him during his mother's pregnancy.
I was told I have syphilis, but I never had any symptoms.
Leading specialist Dr. Jean-William Papp is fully aware of the problem across the country.
We believe that syphilis would account for at least 1/5 of spontaneous abortions or neonatal deaths here in Haiti. The major problem we have with syphilis, patients don't feel anything.
Issue applied in Ecuador. Congenital syphilis remains a major public health problem. Prenatal care has not yet been met. The spreading grid covers most maternal syphilis infections go untreated.
Although the treponema antibody test was positive. So we went back to the history. I asked the mother, have you been tested earlier in the pregnancy? And she said that she had been tested in the second trimester. She got back her file, and that time her titer was 1:32. And she had received 1 dose of benzathine penicillin here. So definitely this mother had syphilis during her second trimester, and she'd been treated for it. Now, is this mother adequately treated? We need to know that, because if this mother is adequately treated, probably she won't pass on the syphilis to the child. So the treatment of syphilis in adults is basically 2.4 million units of benzathine penicillin, 1 dose intramuscularly. And how do you assess response to therapy is you do a titer and look after 4 weeks whether it's fallen by 4-fold. If it's falling by 4-fold, you know that the mother has responded. Usually any patient who's treated for syphilis, the VDRL will become negative over a period of time, and usually in 1 maximum 2 years the VDRL titer should be negative. So you need to monitor these patients over a period of time. So in this mother, when we assess, VDRL was positive 1:32 second trimester. At the time of delivery it's fallen to 1:4. So there has been a decrease by 4-fold. So she seems to be adequately treated. The question arises is...
Conclusion. Congenital syphilis is an easy social and medical problem to treat with diagnostic and treatment promptly, but effort to decrease. The incidence of congenital syphilis has not been announced. The main causes are the lack of knowledge on the part of the doctor who carry out prenatal control and those who receive labor in hospital, and inefficient and untimely treatment.
Infection caused by a spirochete known as Treponema pallidum. And I think you can see from the attached picture that this microorganism is spiral in shape. Syphilis has not gone away. Indeed, there are 11 million new cases globally every year. The highest incidence in the United States is among men who have sex with men, especially among poor minority communities in the southern United States. In Europe, the rates are between 4.4 and 10.4 per 100,000 population, with especially increased rates in Eastern Europe and Russia. The epidemiology of syphilis has been greatly influenced by the HIV pandemic. There are very high rates of HIV infection among people who are diagnosed with syphilis. Syphilis affects 1.5 million pregnant women each year, and about 50% of those